And coming up next, I believe, is Dr. Richard Bach from Washington University, Barnes-Jewish. Richard, I'm going to ask to unmute you, and if somebody can help me bring him to the front stage. Good morning and welcome to HCM Awareness Day. Rich, how you doing?
Morning. How are you? Can you hear me, Lisa?
We can hear you.
And can I share my screen for some slides, do we think? You
absolutely can.
Let's give it a try. Can you see my slides?
Yes, but you're not in present mode yet, so you're almost there.
Here we go.
One more click, maybe two.
Okay. Is that up on the screen?
Perfect.
Awesome.
The stage is yours.
All right. I know I only have a few minutes. I want to say first that I'm very grateful for Lisa inviting me to say a few words about our center here at Barnes-Jewish Hospital. We are in the middle of the country, St. Louis, Missouri. It's a little cold here today, but sunny, so that's nice at least. But I've known Lisa for, I think it's more than 20 years, Lisa. We met at a National Heart meeting. And I have to say, there is no one who has done more for HCM patients over the years that I've seen. You have been a remarkable guardian angel and maybe pit bull, if you don't mind the analogy, for anyone with this diagnosis nationwide and now globally. And it's been impressive to see what's evolved over the past 20 years. As you know, I got involved in this field also more than 20 years ago and felt it important to create a center here at our institution because I saw there needed to be better awareness, there needed to be better treatment, there needed to be comprehensive care, and the fragmentation and lack of awareness that existed, and it still persists. It's an ongoing battle. And today is just an example of the kind of work you've done to improve awareness and improve the care of individuals with HCM. So I applaud you for that. I applaud this day, and I'm very grateful for the opportunity to participate in this Awareness Day. Here's a nice picture of our institution. It also keeps evolving. They're knocking down and building new buildings all the time. So we're making even improvements in the infrastructure here. But what I really want to talk about today is some of the wonderful people that I'm fortunate to work with in our center. I think in the previous couple of centers you've heard about, they're describing those services that are available for patients. And likewise, I want to take a few moments here to talk about the wonderful people at our Center of Excellence here at Barnes-Jewish Hospital, Washington University. Because they really are the family. You brought up that term, Lisa. I believe in it strongly. Not only are the patients who come here joining our family, but the physicians that I work with are the core of my family here for providing expertise and comprehensive management for anyone who has hypertrophic cardiomyopathy, whatever their issues are in their family. And so we are making a commitment to anyone who comes here. You see at the center of this diagram, it says Center of Excellence. What's really at the center of this community is the patient who comes to our center, because that patient will have available any of these different wonderful individuals who can provide expertise, not just expertise in cardiology, but special expertise in hypertrophic cardiomyopathy that's been growing and developing for more than 20 years here. So you see my picture over here on the left. I've been directing the center, as I said, for many years here. I started my career as an interventional cardiologist, and I have a nice relationship with Lisa regardless, I hope. But what I learned early on is the septal reduction procedures are really only one aspect of the care of an individual with hypertrophic cardiomyopathy. And we really want to focus on shared decision-making. Everyone on this diagram is a strong believer in our core philosophy of shared decision-making for even the earliest decisions family screening, genetic testing, medical treatments, but then very importantly, decisions regarding invasive treatments like septal reduction therapies. They're all part of a more general format of shared decision making. So I spend a lot of time in the office now. I see many of the patients myself, but some of my colleagues also see patients in the office, but we share this philosophical approach of shared decision making. And as Sarah said so nicely, education that is part of learning about what hypertrophic cardiomyopathy means, what it implies for the patient and for their family, and how that fits into a bigger picture of the context of management issues and care. So we don't want to neglect the very important aspects of the fundamentals of medical treatments, of symptom management, of quality of life. All of that is part of our assessment for an individual who comes to our center. Many individuals do come to our center from the entire region. So we would like and serve as a resource for the community, not just locally here in St. Louis, but for the entire region in the Midwest. And one of the amazing things about Lisa is that sometimes she's calling me on her cell phone, and she catches me any time of the day or evening to let me know that she just had a conversation with a patient who might be in trouble or having trouble finding appropriate care. And we will respond to that by getting that patient in to see them as quickly and as importantly as we can to help start catalyzing appropriate and comprehensive care. But let me introduce you to some of the other individuals who are on this slide. Anita Bondawad has been working with me in the center and seeing individuals in the office. Also for many years at our center. She's a very caring and wonderful physician in our center. And she goes to the mat for her patients with respect to establishing the diagnosis, caring for them and their family members. And Anita's been one of the foundational people in our center. Sharon Kressey is our imaging specialist, if I might call it, for echo imaging. She has special expertise in echocardiography and is a very experienced echocardiographer here, probably about 30 years at this institution, working in echocardiography and genetics. So she wears two hats in our center. She provides special expertise in echocardiography. If you're aware, she just put together, along with some of our other colleagues, a publication about the evaluation of mitral regurgitation in individuals with hypertrophic cardiomyopathy and assessing whether or not there's intrinsic mitral valve problems that might need independent management versus mitral regurgitation being secondary, as it typically is, to outflow tract obstruction in individuals who have hypertrophic cardiomyopathy. And that was just published a few months ago. So Sharon represents part of the research side of our institution as well. And she provides the high-level genetic counseling for individuals who are either interested in or have indications for genetic testing and family screening. So she'll see individuals in the office or by televisits to help them determine whether they want to and then move ahead with genetic testing. And so she does a lot here with respect to both imaging and management of individuals and their family members for the sake of the Center of Excellence. Many of you who have come to our center will know Mary Gliva. Mary Gliva is a leading electrophysiologist at our institution and nationwide. Mary has special expertise in hypertrophic cardiomyopathy. She's been a member of our Center of Excellence for many years. And she has the kind of expertise that can help with many of the typical electrophysiologic accompaniments of hypertrophic cardiomyopathy, whether it's determining whether a preventative ICD is indicated or a patient needs management for arrhythmias like atrial fibrillation or ventricular arrhythmias. Mary has a very caring demeanor and is someone who spends a lot of time. One of the themes of our center is that our physicians do spend a lot of time with their patients in the office. And Mary does that to a fault. So she helps with educating individuals, with determining their needs, and with providing what is expert management for these very complex arrhythmia situations that are very common amongst individuals with hypertrophic cardiomyopathy. We're fortunate to have added in the last few years Justin Hardapy, who is another member of our group and who has special expertise and training in heart failure and cardiac transplantation. He's a member of our cardiac transplantation team. And so Justin, with both special expertise in hypertrophic cardiomyopathy and in heart failure management, provides a very important component for individuals who have advanced stages of heart failure and who may need consideration of cardiac transplantation. I've always felt that it was an important component of a comprehensive center to have an individual on that group on our Center of Excellence team who has special expertise in cardiac transplantation. So individuals who need to at least have consideration of that as a treatment option have a person in their corner who can help them go through all the steps it takes to get appropriate evaluation. And some individuals who develop refractory and severe advanced heart failure may need consideration of advanced cardiac support options, of which Justin is very well versed and a special expert in any of those considerations. We've also added another, a relatively newer member, Mustafa Husseini, who provides some additional training and expertise in sports cardiology. So another aspect of our center is that for young individuals or any individuals who have questions regarding sports issues or how to manage the potential for evaluation for sports when heart disease, including hypertrophic cardiomyopathy, is on the table. Mustafa is a welcome addition in that regard. And then finally, when it comes to septal myectomy, we have a couple of very experienced surgeons. Dr. Ralph Damiano has been our head of cardiac surgery here for many years. He has additional wonderful, and we're fortunate to have special expertise in Mays surgery and in a mini sternotomy approach. And so individuals here who come for septal myectomy have a very experienced surgeon. We have a very large experience now, a large volume of over the last several years who are managed by Dr. Damiano with respect to myectomy being done either by a mini sternotomy or traditional sternotomy. And then for those individuals with coincident arrhythmia problems like atrial fibrillation, he provides really advanced level technical skills in Mays surgery as well, with some very nice outcomes that I can vouch for over the last several years in a situation that may provide some challenges for management. That is atrial fibrillation in patients who are symptomatic from it and having difficulty with medical management, or as we know, some challenges with catheter-based ablation. And more recently joining our group from the Mayo Clinic is Kunal Katkar. And Kunal, another fantastic surgeon. He also has special expertise in advanced cardiac support surgery. But Kunal has also provided some of the newer techniques with apical myectomy surgery. He and Dr. Damiano work together on many of the cases. We have, as many of the centers likely have, a multidisciplinary meeting on a monthly basis where we discuss some of these more complex cases and decide as a team approach with the expertise of the entire group as to whether patients may be candidates for more advanced treatment options. We're very fortunate at our center to have surgeons who have skills in those advanced treatment options. So this is the group that one might meet if they come to our center for care when it comes to hypertrophic cardiomyopathy. And I would say, care is our watchword. I'm a person who believes very strongly, and I learned this the hard way in the early days of our center, that individuals really do need comprehensive care. The secret of caring for patients is caring for the patients. And that rings true, especially with hypertrophic cardiomyopathy, where the problems don't just involve one individual who has the diagnosis, but their entire family and implications for the future. So we take this philosophical approach for the care of the individuals, and I would emphasize all of these individuals are very caring, very wonderful physicians who I would love to send any of my family members to if they had any sort of cardiac problems. But fortunately, they have special expertise in hypertrophic cardiomyopathy. Just so that individuals who are interested are aware, this is the number for our center. It goes directly to my office, and my assistant, who's named Millie Kova. Any of you who've come here know Millie. She moves mountains to get patients in, to have them get triaged to the right place, to have them get their imaging studies. We have, like the other centers, you'll hear advanced technical expertise in imaging for hypertrophic cardiomyopathy, both with respect to echocardiography. We have sonographers that were hand selected and have been doing all the studies for hypertrophic cardiomyopathy over the last several years. So they really have done thousands and thousands of studies. And when an individual comes with sometimes complex anatomy, they can provide imaging that's hard to match anywhere you'll find in the country. So Millie will help coordinate any of that for any individuals who would like to come to our center. I shouldn't leave out, we also are proud of the fact that we are a research institution here. And so when it comes to newer treatments, and that includes the newer medical treatments that are on the horizon and very exciting. And again, Lisa has found the right time to have an awareness day because very soon we're anticipating there may be some new treatment options. We've been doing those studies like some of the other centers since the beginning when it comes to the myosin inhibitors like mavacamten, but not just mavacamten, but other agents that are in testing. We are participating in clinical trials that if individuals were interested, we have a nurse coordinator who, like everyone else, very caring, very involved in education of patients, would be happy to discuss the involvement in any clinical studies for anyone who would like to volunteer to those studies. And that's sort of, once again, the approach that we have. We want to support individuals so they have access to these studies of new medications that are very promising, very exciting, but it is entirely on a voluntary basis. So anyone who's interested, please feel free to contact me at the number you see on the screen. And Lisa, that's all I have about the center here at Washington University. I want to thank you again for giving me the opportunity today to participate in this great session. Thanks.
It's great to have you. Couple follow-up points, because you got me on a jab there on the interventional cardiology thing. Don't think I missed that. I did not miss that. So I think we need to let people understand that you and I met, and I don't even know how this is possible because I'm 28, right? We met in the late 90s. And
Yes.
At that time, this concept came from Germany, this alcohol septal ablation. It was going to be the panacea. And shout out to Bill Spencer, who adopted this with unbridled enthusiasm and shared the message far and wide that this is a great treatment for HCM. Well, he was right and wrong. And a lot of people kind of drank a little Kool-Aid on that one, like this was it. It was the thing. Well, it's the thing for some people, not for everybody. And I was just coming off the tails of dual chamber pacing was the thing. It was going to be the fix for everybody. So I was starting my life in advocacy with a raw mark on dual chamber pacing. And now there was this thing called alcohol septal ablation. I'm like, okay, everybody needs to cool their jets because we saw what happened just a few minutes ago. And that's kind of when I met you. And I can remember going up to posters and standing there next to you, kind of debating, like, why would you do this? Why wouldn't you do that? What about this? What about that? And this look on your face is like, who the hell is this girl?
Well, Lisa, I want to say, I come from New York, so I very much respected your skepticism. I think it's healthy skepticism. When it comes to any new treatment, all of us need to be skeptical enough that we have care and attention to the details. And it turns out, I'm a strong believer, as you know, that alcohol ablation is an important treatment option for many individuals.
I agree.
Because they're not better candidates or good candidates for surgery, or they would prefer it. And so I would put that plug in that it fits a very important role in the treatment of patients with obstructive hypertrophic cardiomyopathy. And I would still advocate for that. But I respect, and in fact, I think it was healthy for the field to have that skepticism early on. And I'm glad we didn't all drink the Kool-Aid and end up like the people in Jonestown. Thanks very much for that analogy. But I do think
we all got excited together. We all got calm together, and we found equilibrium together.
Good.
And,
yes, I agree with you.
And I think that's the long story of HCM, is that we roll and we evolve and things change, and we have to be smart enough to know what we don't know and brave enough to come up with ideas and try them and find where everything fits. We used to have a very scant toolbox. We got some tools now, and it's awesome to have tools for patients. Rich, I thank you and your entire team for your continued support, and thank you for joining us on HCM Day.